Deirdre McGill, and I'm the Executive General Manager of the Bolton Clark at-home support team across Australia. And Bolton Clark is the largest not-for-profit aged care and community provider across Australia. And we've had a combined 200 years of care and services to people in the community, wherever they call home, including their own homes, in retirement living and in aged care homes. Bolton Clark's purpose is to support people to live a life of fulfilment. And as such, we provide significant care to people across the range of care and support to keep them as healthy and well with quality of life as possible. There was a need we were recognising through COVID that people were socially isolated, that they were in lockdown and restricted from their local communities, families and friends, and as such it was having an impact on their health. We identified as an organisation that we had a very key position to play in supporting people to improve their health outcomes, but also their social outcomes. And the World Health Organization has a significant focus on health outcomes through social involvement, connection, relationships, ending loneliness as such. Through the Ian Potter Foundation, we sourced some funding, which was a fairly spectacular 4-year program to support people through a connecting to their local community. And this involved having a paid carer from our organisation, seeking the supports in the local community to provide social interaction with what was currently in the community, but also with other community members. Bolton Clark is collaborating with Alfred Health, South East Melbourne PHN, and the Australian Disease Management Association. The steering committee is also made up of the Council of the Ageing, Ambulance Victoria, Safer Care Victoria, and Victoria Health Department.
My name's Anne Van Leerdam. I work for Bolton Clark. I'm one of the community connectors for the Connect Local program. Connect Local is working with people who are 65 and over and people who are living in the Glen Ira area in Melbourne. Connect Local is a program that works with local residents who would like to get involved in local activities, either because they're socially isolated or they're experiencing real loneliness. So they can be referred to the program through their doctors or healthcare professionals, or they can self-refer through our website. So they come to the program, and my job is to connect them in with local activities and programs that are happening in their neighbourhoods.
My name is Dr. Raina Ogren. I work as a Senior Research Fellow at Bolton Clark in the Bolton Clark Research Institute, and I'm the project lead for Connecting Communities to Care, which is implementing the Connect Local program. It's a very interesting area, social connection. It came to prominence because researchers about 2015 released an article that identified that loneliness and social isolation leads to earlier mortality. And so much research has been done recently looking at, well, what is needed to prevent serious poor health outcomes. So social connection has been identified as increasing longevity, has been identified as reducing cardiovascular disease, stroke, type 2 diabetes and other health issues, including mental health issues. So the evidence is starting to consolidate, but there are gaps, and we don't really understand a lot around who benefits from what kinds of interventions are out there. And we need to focus a little bit more also on really robust evaluations of the impact of interventions to support people to connect socially. Connect Local is actually being undertaken in the Glen Ira City Council region. We've spent a great deal of time initially reaching out to local service stakeholders, healthcare providers and local community members to work with us in co-design to shape what this program looks like so it meets the needs of those older community members but is feasible for those providers to engage with and support people to access. So now we've actually progressed onwards to support, to engage with community connectors and get them out into the community community to raise awareness about this program running. It's done by trusted providers and engaging those people who need this support and might benefit most, and so that they understand what we're doing, how we're going about it, that it's all about supporting them and linking them to social activities that meet their needs. And it's about what they can do as opposed to focusing on what they can't, which tends to be what services do up until now in that more medical approach. We're really looking at that biopsychosocial approach around focusing on the goals and needs of those community members so they can live that life of fulfilment.
I'm Dr. Daniel Feinberg. I'm Deputy Director of General Medicine at the Alfred Hospital. I'm involved in all aspects of care within the hospital walls for inpatients as well as the outpatient program, and involved in administrative and education and research processes with other stakeholders, including the Australian Disease Management Association and other partners. I'm a principal investigator for this Connecting Communities to Care project. This is a collaboration between Alfred Health, Bolton Clark Research, the Australian Disease Management Association and the primary Southeastern Primary Healthcare Network. We're involved in the coordination of this project and supporting the implementation and evaluation of the project. ADMA is an organisation that has government funding that provides a connection between primary care, hospital care and other community stakeholders that are involved in care of people. It supports an understanding of what services are available with each of the organisations and provides a connection for organisations that may be siloed in their own sort of space to communicate with each other. The main activities of ADMA at the moment are providing a regional communities of practice where they support discussion and interaction with community stakeholders, as well as a nationwide social prescribing initiative looking at a better understanding across the nation for people who are engaging in social prescribing, as well as what activities and research that's been done in that space.
We are right now in the second year of our journey in this Connecting Communities to Care project, where we've spent a year in co-design, working with those key stakeholders, including older community members, as well as social and healthcare services, to shape what that program builds up into. We have a website, we have telephone access, we also have seeking referrals through a website, and also healthcare providers and local community members, so that we can access those people in the way that they choose.
Participants who have been through the program have had such great feedback, where I've been able to connect them in with the local men's shed, the neighbourhood house, local canasta games. And what we're seeing is that the participants didn't know how to. And so that initial barrier was so big for them, even though a few of them had been living in Glen Eira for 40 years, didn't know how to connect in with local programs. So that's why this Connect Local is really important, because we are the connectors. When people don't know how to, we can provide pathways. And it's been really fabulous for local community groups as well, because they're experiencing decline in numbers. And so it's the holistic outcome is fantastic for the participants. They feel connected. There was one gentleman who didn't speak to anybody for 5 days in a row consistently since his wife died. So for him, connecting in with a group of men his own age down at the men's shed has been life-changing for him. And the men's shed are so thankful that he's part of their group as well because of what he brings. So that's the beauty of of Connect Local. It's not just about the individual, but it's about what they can give to the groups and how the groups can give back. So it works in harmony, and through that, good outcomes for individuals, but also better outcomes for our communities. It builds robust, resilient communities as well.
Part of the evidence base that's missing is robust evaluation on the impact of social connection activities on community members. So we're doing a really substantial amount of evaluation, looking at not just the outcomes on individuals engaging in the program, using validated surveys on loneliness, social isolation, wellness and other aspects. We're also going to do interviews, but also reaching out to community groups and health service providers to understand the impact on them. And we're also going to look at the community in general and the health system impacts.
We'll be measuring people who have chronic health conditions in terms of how they're accessing healthcare, how their chronic health conditions are going, and associating that with any loneliness, isolation markers and general wellbeing. We'll be measuring that at baseline at 3, 6 and 12 months.
We're also going to engage with undertaking a social return on investment evaluation on economic impact of the program, to look at the social value that this program provides. And the third thing we're looking at is the implementation of this program, because it's all well and good to actually say that we're going to be doing these activities, but we need to actually show that we actually did what we said we're going to do. And so that's the implementation evaluation.
We'll be in a process of iterative design, co-design. We're looking at producing results as we go along, communicating back to stakeholders, looking at opportunities to produce these results in peer-reviewed journals, and also and as we get data at the end, hopefully having outcomes that can evaluate the whole project and look at how we would maintain social connectors in the implementation of improving, reducing social isolation.
We anticipate collecting information about participants through a 12-month period of engaging in the program. So once they start, it will be 12-month follow-up, and we hope to recruit people over 12 months. So we probably won't see outcomes until about the 2024-2025 period, and the end of the study will be mid-2025. So give us a bit of time to put that together, and hopefully the second half of 2025 will have those results.
I really enjoy direct patient care and see a lot of people access healthcare that often the treatment algorithm is fairly straightforward, but depending on their context and their experiences, things are completely different. And social connectiveness, I think, is a really significant issue for people who access healthcare that we don't know a lot about, that we have, I think, challenges to understand within health professionals as well as our patients. And hopefully understanding this more, understanding the data that can generate from this project will help us look at better ways to engage with our patients, either whether they're in hospital or out in the community.
I really want to change the world. I see that social connection is a key aspect that underpins people being able to live a life of fulfilment. We actually used to do research focusing on specific health issues to deal with one population group, and our research has identified that actually what makes people well and live a life that they wish to is connection with others. So that made us shift our perspective on our research and look at these initiatives that tap into those activities that are already underway in the community, and see about engaging people and supporting them to engage in those activities so that they can connect in their own communities and flourish.
I'm really passionate about Connect Local. I'm a community development worker, and I also have a counselling background. I've been working in the not-for-profit welfare sector for over 20 years, And Connect Local brings together all the key principles of good community building. It's person-centred. They're the expert of their lives. Tell me what you want. Tell me what you're interested in. And we can help facilitate that.
Social connection is important for people's health and well-being, and the importance of Connect Local is the ability for it to expand nationally and internationally, so that social prescribing, the importance of connection, social prescribing versus a health outcomes will benefit the community, not just here in our local area, not just in our local state, but nationwide and also nationally, internationally, and in line with the World Health Organisation's mandate for better outcomes, better health, better engagement.